Hello parents. One common thing with which all parents are, tired of is the cry in their baby. So, let me tell you one clear thing. The only two things that the baby knows to do perfectly till at least 3 months of age is crying and feeding. So, you can't expect your child not to cry at all. Healthy babies also cry for hours sometimes without any obvious reason. One common reason with which they cry is boredom. They get bored. Yes, like you and me, they also get bored, and the only way they can convey that is by crying. So next time your child is crying, you make sure there are at least 5 to 6 things that you should have checked. One thing is feeding. Feed the baby properly. Second thing is burping. Burp the baby after each feed properly. If you don't burp the baby after every feed, you skip 2-3 feeds without burping, this causes a lot of gas troubles and then excessive cry in the baby. So this also you got to check. Next thing is see for the wetness of your nappy. If the diapers are wet or the cloth diaper that you use is wet, the surrounding area, the bed sheet and the covering cloths are wet. That is also one reason why kids cry. Or if they have passed motion and you haven't cleaned that area, that is also one reason they can cry. And then you check for cold stress. So what you do to check the cold stress is you use the back of your hand, touch the tummy of your child, and then touch the legs of your child. Generally, the legs should be as warm as the tummy is. So if the legs are colder than the tummy, that means the baby is cold. This is called as cold stress. So whenever mothers pick up this cold stress, you should immediately swaddle the baby. Cover the baby in a nice warm cloth or put the baby on your chest so the heat from your body is transferred to your baby. So this also settles excessive cry in many people. So these are all the common things that you got to check when your child is crying. Sometimes your child might be crying just because of boredom. So you got to play with your kid, you got to speak with your kid in your own language, play some nice music. So you can play some music, but strictly no screen time at least till 2 years of age. So when should you consult your pediatrician with this complaint of cry? Yes, we label this as excessive cry only when a child is continuously crying at a stretch for more than 3 hours a day and is unconsolable. Whatever you do, the baby is never getting consoled. So 3 hours, more than 3 hours per day, and such episodes for at least more than 3 times in a week. So this is the time when you should consult your pediatrician. Take care, stay safe.